Hello, everyone. I'm Dr. Kat Khorrami. I am the medical director of Allurant Medical. And today I want to talk a little bit about our program for hormone optimization. I feel like this was the least talked about or understood program because every time someone comes and finds out that we are addressing hormone deficiency and optimizing the hormones, they're surprised. And this is started out as a by and by story is it started as wanting to optimize the skin. And then it became very apparent how life changing it is to have the hormones optimized to a level where it's at the best functioning for that individual. Hormone optimization is typically sought out by people that are going through menopause or andropause or changes that are associated with a decline in the hormones. Now, in women, menopause and the stopping of the periods is something that physically marks a transition. But the hormones start declining in our 40s. And many people don't know. They just get maybe get the hot flashes occasionally, but get mood changes, trouble with sleeping. And it's often at a time when women are going through changes in their families. They have young kids. The relationship is not the same with their partner because of the kids or because they're going through some career changes. It's really difficult for people to know whether what's happening is related to their hormone and is often missed. Hormones are not vitamins that you can just take it when you feel like it. So it has to be determined whether the person needs it, how much do they need, and how do you manage it. There's many different ways to optimize the hormone. In this clinic, in Allurant Medical, we have chosen to address hormone optimization by pellets primarily. Pellets are little pills that are inserted under the skin, usually in the buttocks for most people where there's some fat tissue. And it's done every 3 to 4 months for women, every 5 months for men. We would take your weight, do your measurement blood work, determine where your hormones are at, and determine what is the correct dose for you. We'll see how are you metabolizing this hormone, how is it affecting your level. Once you hit a correct dose for a person, then you get your pellets every 3, 4 months for women, every 5 months for men, and they have blood work once a year. So that's the process of it. What is expected from hormone supplementation is the reversal of some of the changes that happen. So for men, they find that they're tired, especially after having a meal, they need a nap, they're not quite able to make muscle the same way they were able to in their 30s, maybe 40s. Surprisingly, our cognitive function and memory is very tied into the level of testosterone, brain fog, difficulty having executive functioning, planning, all that stuff is correlated with the testosterone. It's such a gradual decline for most people that people think, well, maybe this is the new me. This is aging. That's sort of been the narrative. And we're finding out this is possible to optimize the hormone without jeopardizing the long term and actually helping with the cardiac health, with the bone health, with brain health for preventing dementia and Alzheimer's. So the consultation is needed to determine is the person a good candidate. For women, it's a bit more noticeable because of the hot flashes and the cessation, the stopping of the periods that happen. However, more and more we're seeing with the awareness that's going on, we're seeing people in their 40s that are still menstruating, but they're having a decline in their testosterone for multiple reasons, maybe lessening of the ovaries, producing estradiol, causing headaches, causing premature hot flashes, vaginal dryness. So these can all be addressed and optimized. Optimization means that we're going to take the levels. If you look at a curve where there's a low end and a high end and there's a bell curve, we're going to go past the majority and the midline and optimizing as if the person is in their 20s and 30s. So marrying the levels on that graph as well as the clinical symptoms. I say, and many people also agree, that the best thing to do whenever you're putting something foreign into your body is to go with the least amount of dose to get the most amount of benefit. So very conservatively moving forward. The hormones that we prescribe here are bioidentical, derived from plants, meaning that they come from yam and soy, and the molecules are the closest to the human molecule versus the chemical component. Another option is sublingual taking of the medication. And that is really excellent for getting it into the bloodstream through the mucosa in the mouth. However, it does have to be done at least once a day, maybe preferably twice a day to get a smoother curve of the rise and fall of the hormone in your bloodstream. For men, in addition to pellets, we also offer injectable testosterone, which is injected once a week, sometimes twice a week, depending on the situation, to have an optimal level. Some men prefer injecting versus getting pellets, and that discussion can be happening in the consultation. So if you think you may need hormonal supplementation, the easiest thing is to go through a questionnaire, go through the different symptoms, go to a consultation, usually with me or with my nurse practitioner, and determine whether you're a good candidate for hormonal optimization. And then we'll take the steps forward to address that.